Hi there, it's Justin Lubino with Senior Advisors. And each year we like to create this video that helps explain how Part D of Medicare works. There are some changes to the program each year, so we like to highlight those changes. So this video is going to explain in a brief and concise fashion the changes that are coming for 2022 to the Medicare Part D program. So Medicare Part D, there's about 30 different Part D drug plans to choose from in each state. And we have separate videos out there that explain how we pick the best Part D drug plan for each individual. So I recommend, if that's something you're interested in, you could check out our other videos that walk you through the tools that are out there to find the most cost-effective Part D drug plan. But this video is really just focused on the framework to help you understand how Part D of Medicare works. So this slide here explains the different steps within Part D of Medicare and the changes that occurred from 2021 to 2022 with each of these steps. The first step is the annual deductible. All right, so these Part D drug plans can have a deductible, but it can't exceed, for next year, 2022, it cannot exceed $480 for the deductible. Now, if your Part D plan has a deductible, which most of them do, the deductible generally only applies to higher tier drugs. On some plans, it's tiers 2 through 5 drugs. On other plans, tiers 3 through 5. But generally, the deductible doesn't apply to tier 1 drugs. So if you have a low-cost generic drug on a lot of these Part D plans, there's going to be a zero copay or very low copay, even if the plan has a deductible. Okay. Now, if you have a higher tier drug, like a brand name drug, you have to meet that deductible. You have to pay the full cost of that drug until you meet the deductible in order to get to the next phase. All right. So that's the first step within the Part D drug plans. And this is calendar year, January 1st to December 31st deductible. And it went up from 2021 to 2022, it's $35. So it was the maximum deductible on these drug plans went up from $445 to $480. Now, the plans could have a deductible that's 0 or 200 or 150 or any number lower than that, but it can't be any higher than the maximum deductible, which is $480 for next year. After the deductible comes the initial coverage level. All right. This year, 2021, it was $4,130. Next year, it went up to $4,430, went up $300. All right. Now, this initial coverage level, this is where things get a little confusing, is based on the retail costs of the medications. So as long as the total retail cost of your drugs for the entire 12 months is less than $4,430, you're just going to pay a copay or coinsurance for your medication. All right. And about 85% of people on Medicare never get past this initial coverage level. Most Medicare beneficiaries have lower cost generic medications, and most people are not going to exceed that $4,430 based on the retail cost of the drug. So they never get past this point, and their insurance just feels kind of similar to, individual pre-65 or group insurance, where you're paying that copay or co-insurance for your medications. Now, where it starts to get very confusing is if you have expensive medications. So if you do not have expensive medications, it's really up to you whether you want to continue to watch the video. It's going to get a little bit detailed. But basically, if you have those expensive drugs that exceed $4,430 based on the retail cost, the full cost of the drugs, that's when you fall into this step 3, which is called the coverage gap. We used to be referred to as the donut hole with Part D. We're still sometimes referred to it as the donut hole. And if you're in this coverage gap, that's when you have to pay 25% the cost of the drug. All right. So you're paying, instead of just maybe a $40 copay for that expensive drug, now you're paying a 25% coinsurance for the cost of that drug. And we're going to explain an example on the next slide so you can see exactly how this would work. to help make it a little bit clearer. But basically, that's the donut hole, or the step 3 coverage gap, is you have to pay 25% the cost of your drugs once you fall into that coverage gap. And only about 12% of beneficiaries reach the coverage gap. And then the fourth step is called the catastrophic coverage. All right. And the way you get to the catastrophic coverage is if you exceed it's called true out-of-pocket cost of $7,050 for next year. That's when you're going to reach the catastrophic level. All right. I don't want to scare people because this is another confusing part with Part D of Medicare, but true out-of-pocket cost does not mean you have to spend $7,050 out of your pocket before you get to this catastrophic coverage. The catastrophic is there to protect you, by the way, so you're not stuck in this donut hole paying 25% for the entire back half of the year if you have expensive drugs. Once you reach catastrophic level, you're only paying 5% the cost of the drugs. So if someone has very expensive drugs, once you get to catastrophic level, it's going to be a good thing because your cost is going to drop to 5%, the cost of that drug. All right. Now, the true out-of-pocket cost, this is where, again, it gets confusing. It's not, you don't have to meet the $7,000 of your dollars, right? It's the total of everything you've spent for your medications up to that point in the year, plus it includes the pharmaceutical discount for brand name drugs while you're in the donut hole. That's 70%. So the way you're only paying 25% while you're in that coverage gap is because the pharmaceutical company is discounting 70% and the plan is paying the other 5%. So the point is that 70% that they're discounting while you're in the coverage gap is going towards that true out-of-pocket limit, which is a good thing because that means you're going to get there sooner than if it just included what you had to pay for your medications. And if you get the catastrophic coverage, again, that's going to be a good thing because you're no longer paying 25%, but now you're paying 5% the cost of your drugs. So I know this can be very confusing, which is why we like to give you an example of how this works. So, and we do this year over year, so you can actually see, we've got prior videos out there, and we try to give you an idea of how these changes to Part D of Medicare impact the actual out-of-pocket cost, the consumer's cost for their medications. So the example, we try to use the same example each year with regards to a one brand name drug, and it has a retail cost of $955 a month. Now, the reality is, drug costs do tend to go up each year. But for the purposes of the example, and we want to show the impact of the changes to the initial coverage level and the catastrophic level, those increases in those limits, we try to keep everything else the same in the model. So you could see, well, what's the impact of these changes on me if I have expensive drugs? So the net impact and we're going to walk through in detail, is roughly, it's about $100 for the year as far as your out-of-pocket cost goes if you have very expensive drugs. All right. So, and again, this is just one example, but for this individual, if you have one drug that costs $955 retail, and let's say with your Part D plan, you had a $40 copay, and this plan happens to have a 0 deductible. All right. So if you had a deductible, that would be another impact in the model, but we try to keep it simple and use the same example year over year so we can see what the impact is to you. So the initial coverage level, we mentioned that increase for next year to $44.30. And these numbers stay the same, the pharmaceutical discount in the donut hole and then what the member pays in the donut hole at 70% and 25% respectively. And then the catastrophic true out-of-pocket limit, again, that went up to $7,050. So these numbers get plugged into the model so we can see the impact on the consumer. So this shows you month by month for a full year what the actual costs would be for a consumer in this example. So if you have that's the only drug you have just for simplicity, but it's really the framework is based on your total drug costs. But if you only have one drug for simplicity and the retail cost was $955, but it had a $40 copay with your plan, when you go to the pharmacy in January, you're just paying that copay. You're in the initial coverage level. Remember, you just pay the copay with your plan. So you pay that $40 copay in January, in February, in March, April. And then in May, you go to get that same medication. And the pharmacist says that'll be $167 basically instead of $40. And that's where people get the confusion and the angst and they don't understand, why did my drug costs just go up? Well, what happened in this example is now you've reached the donut hole or the coverage gap. You've exceeded your initial coverage level. Remember, it's $44.30. It's not based on what you've paid for the medication. It's based on the retail cost. So that's what this row is below here. We're just taking the $955 and you add it up each month. And between April and May, you're exceeding that initial coverage. The $44.30 is somewhere in the middle between the April and the May medication pickup. And so this amount that you're paying in May is not the full 25% the cost of the drug, because it's kind of a blended month. You're still a little bit in the initial coverage level and a little bit into the coverage gap, but it's going to be some blended amount there. In this example, about $167. Then comes June. Now you're fully in the coverage gap and you have to pay 25% the cost of the drug. So again, the full cost, $955, 25% of that is the $238.75. July, August, September, October, you're paying that 25%, all the way until you get to December, where this number drops just slightly because this is a partial month where you've reached the catastrophic coverage. If you look at prior years' videos, we were hitting catastrophic coverage in November before with this example, but because that catastrophic limit went up, now you're not reaching it until December. So we only have a partial month of catastrophic. In prior years, you would see it the partial month in November. And then by December, we'd only be paying 5% of the full retail cost, or roughly $50 for that medication. Because this is a blended month, we still have part of that coverage gap, and then you have the catastrophic blending in there. Okay, so how do we get to that catastrophic level? So we talked about how we got to the coverage gap was with the retail cost. To get to the catastrophic level, it's based on that true out-of-pocket cost, which again includes the pharmaceutical discount for the brand name drug while you're in the donut hole, and the amount the member pays for their drugs throughout the entire year. So the first few months, it's just that copay of $40. Once you get to the coverage gap, now it goes up to $764, goes towards that true out of pocket. And then a full month, it's $907. So you just kind of keep that running total going, and to see when do you exceed the catastrophic level there, the $7,050, it's going to be almost to the end of the year in this example. Again, in prior years, that true out of pocket was, say $6,000 or $6,500 last year. And so we were getting to that sooner in the model. But because now it went up about $500 there, it's taking longer to get there, which means you're paying that higher amount in the coverage gap for an extra month roughly. And therefore, your overall cost for the year for this example is about $100 more than it was last year. It was about $1,850 last year in the same model with the lower initial coverage level and catastrophic levels. So I know this can be very confusing. We try to simplify this as clear and make it as clear as we can for people that have those expensive drugs. I hope this helped kind of walking through how this framework works. And really, it doesn't matter which of the Part D plans, they all have to follow these certain rules that are set by the federal government. So, the same concept of initial coverage level, coverage gap, and catastrophic coverage applies to really any of those Part D prescription drug plans. All right. There's also something we mentioned this in last year's video, but it's really important for folks that have insulin-related medications. Those are expensive medications, even though they've been around for a long time. The retail cost for those medications is still, depending on which one you're taking, anywhere from $400, $500 a month or more. And historically, those folks on insulin used to hit that coverage gap and hit the have to pay a lot of out-of-pocket costs. But there was this executive order passed back in March of 2020 and basically changed a lot of these Part D plans. They don't all have to participate, but most of them do, with the senior savings model, which started this year, 2021, and will continue next year as well. And basically what it does is it sets a flat copay of $35 per month for folks that are on those insulin products, which throughout the entire year, you don't have that variation in coverage gap and catastrophic. It's just a flat $35 a month, so you can budget, and it also reduces your costs. Roughly for a full year, we estimate about $500 per year savings for those that are taking insulin products. So that took effect this year already, 2021, but we just want to highlight it again. That was a big change that helped people save quite a bit, and will continue for next year. Every year we do a Part D review for all of our clients on Medicare plans. So we send out reminders in September to get their latest drug information and rerun their Part D analysis, because these Part D plans change every year. So if you're on Medicare or going to be on Medicare, if you want to take advantage of our review, we have a form you can fill out on our website with your drug information, and we will do the review for you, send you a recommendation and a report as far as which is going to be the most cost-effective Part D plan for you. And this slide just shows why you want to work with senior advisors for your Medicare planning. You have a big smile on your face if you work with senior advisors for your planning. If you do not, you might not be too happy. You might run into some errors or mistakes. And so we obviously would love to work with you on your Medicare planning. We have a bunch of resources out there. You can follow us on Facebook to get updates. We have about 50 videos on YouTube, and we're continuing to add new videos. You subscribe to us there to get the latest video updates. Our website, we've got a full workshop video webinar on our website as well. We've got that Part D form we mentioned. If you want quotes on Medicare plans, supplements, we're happy to get quotes for you. We blog monthly on updates with regards to the Medicare program. So, feel free to check out all these resources. Our contact numbers are also on this slide. So feel free to give us a call if you want some help or just have questions about Medicare. We're happy to help. Well, thank you for watching this video, and we look forward to working with you in the future. I hope you have a great day.